syndrome. Mr. Sam Hamad is a 54-year-old man who lives alone. He immigrated to Canada in 2015 from Syria, presumably fleeing the Syrian civil war. His medical history includes a classification of overweight, and he's on blood pressure medication, and he lives a sedentary lifestyle with a stable job and unhealthy nutrition.
Metabolic syndrome is a disorder that significantly increases the risk of developing several serious chronic illnesses. It is caused by deregulated metabolism. These chronic conditions include type 2 diabetes, atherosclerosis, heart attacks, and strokes.
The risk factors include visceral obesity, high blood sugar, high blood pressure, high triglycerides, and low HDL. Mr. Hamad has 4 out of 5 of these risk factors.
For Mr. Hamad's case, we applied an adapted medicine wheel framework as a way to bridge indigenous epistemologies with Western research methods to examine disease pathology and social determinants of health. The two-row wampum is shown here to represent the parallel Western and indigenous ways of life, symbolizing an ability to coexist. The cultural safety, identity, resilience, and relational trust. For Mr. Hamad, spiritual factors contribute to both barriers and strengths in managing metabolic syndrome. Resilience and strength is the ability to adapt in the face of adversity. Mr. Hamad immigrated to Canada as a refugee and is navigating unfamiliar social and healthcare systems. Successfully leaving his home country in search of safety demonstrates resilience. However, stress, stigma, and ongoing concern for family can reduce self-confidence and make it difficult to maintain healthy lifestyle behaviors, contributing indirectly to his metabolic disease. Cultural safety and trust is healthcare free from discrimination, and it is an important spiritual consideration. The presence of Islamophobia may weaken trust, as doctors can unconsciously interpret language barriers or unfamiliar health beliefs as noncompliance rather than system navigation differences, which contributes to culturally insensitive care and reduces patient engagement. Identity and sense of belonging, which is connection within a community, are also central to spiritual health. Displacement due to war can result in disconnection from home, religion, and community. Mr. Hamad may experience marginalization or racism and a lack of belonging, which can negatively impact motivation and well-being. Several supports and resources could strengthen Mr. Hamad's spiritual health and improve outcomes. Sensitizing healthcare professionals on culture, social determinants of health, and resilience, while when working with Syrian refugees is essential. Community-based supports like the Syrian Community Center work to develop resources, relationships, and events that promote a healthy transition into Canadian life and support a sustainable lifestyle changes. Finally, clinicians can improve cultural safety through perspective taking and individuation, focusing on Mr. Hamad's lived experiences and individual needs rather than stereotypes. The image on the bottom reflects the reality of the Syrian civil war and contextualizes the cultural and spiritual loss experienced by many refugees, including Mr. Hamad. I also included an upcoming events list from the Ontario Syrian Community Center that would help Mr. Hamad form a community and foster spirituality.
The maximum amount that someone can do, and mobility is the ability to move easily. Mr. Hamad's habit of skipping meals and relying on sugary foods may lead to malnutrition, specifically overnutrition, which can weaken his immune system, cause fatigue, and weakness. Medication side effects such as fatigue, loss of appetite, and muscle cramps may further limit his ability to stay active and eat well. Being overweight also increases his risk of conditions like sleep apnea, asthma, and osteoarthritis. Additionally, metabolic syndrome is associated with reduced exercise capacity and impaired heart rate recovery. Together, low energy and mobility challenges make it difficult for Mr. Hamad to adopt healthier lifestyle habits. Comorbidities is a disease or medical condition that is simultaneously present with metabolic syndrome like cardiovascular disease, diabetes, and atherosclerosis. Raising awareness for metabolic disease is essential for early detection and timely lifestyle changes that reduce risk factors and comorbidities. Mr. Hamad's condition may have been identified earlier, as his high blood pressure and long-standing shortness of breath were early indicators of metabolic syndrome. With proper management and prevention, disease progression may have been avoided. To manage his condition, Mr. Hamad must adopt gradual, sustainable lifestyle changes, including limiting calories, reducing sugar, sodium, and unhealthy fats, increasing daily walking, eventually adding resistance training. Successful implications will require a support team including a cardiologist, endocrinologist, dietitian, pharmacist, and physical trainer.
May influence Mr. Hamad's ability to manage his health. He immigrated as a refugee, which may involve past trauma, stress, and loss of social networks. Refugee experiences are associated with higher risks of anxiety, depression, and long-term stress. This can affect metabolic health through cortisol dysregulation. Housing also plays an important role in mental well-being. A stable, safe living environment helps reduce stress, while instability can increase psychological strain and negatively affect health. Family and community connections are equally important. Supportive social relationships foster belonging and resilience, while limited support can increase isolation and reduce mental well-being. Ceremony, or access to culturally meaningful practices, supports identity and grounding. Limiting access to these practices after migration may reduce emotional resilience and overall well-being. Mr. Hamad's work as an accountant is largely sedentary and may involve long hours and deadlines. This mental load can lower motivation for physical activity and contribute to stress-related or emotional eating. Healthy literacy is another factor. Limited nutritional knowledge and being told he has metabolic syndrome may feel overwhelming, reducing confidence in his ability to manage his condition. Additionally, trauma-related stress responses, including those associated with PTSD, may increase chronic stress and make sustained lifestyle changes more difficult, highlighting the importance of trauma-informed care. Recommended mental health interventions include trauma-informed and culturally sensitive care that frames lifestyle changes as supportive rather than corrective and avoids blame-based language. Integrated mental and physical health education can explain how stress, sleep, and emotions affect blood sugar and cardiovascular risk. Encouraging community engagement can strengthen social support, and routine mental health screening for stress, anxiety, or depression can support early identification and create better long-term outcomes.
Refers to how we manage our feelings, relationships, sense of belonging, and ability to cope with stress. Emotional imbalances can have a significant impact on physical health. Several factors in Mr. Hamad's life influence his emotional health. Using the concept of causality, we can see how these factors contribute to emotional challenges. Mr. Hamad's sedentary lifestyle can contribute to low mood, increased stress, and reduced motivation. Social isolation is another factor, as being single and separated from family can reduce emotional support and increase feelings of loneliness. Additionally, his immigration experience involves major life changes, including loss of familiarity and social networks, which can lead to emotional distress. Supporting Mr. Hamad through patient-centered, culturally sensitive care, community connection, healthy coping strategies, and access to counseling can strengthen emotional resilience, reduce isolation and stress, and improve overall emotional health.
That metabolic syndrome is at an early stage, so that with sustained lifestyle changes and controlled blood pressure, he can have favorable prognosis. Treatment recommendations include trauma-informed, culturally sensitive care, lifestyle changes like exercise and diet plans, and the ability to access community supports and services and education. Mr. Hamad's prognosis can be improved by applying indigenous epistemologies to his care. Overall, by addressing all four of these domains, physical, mental, emotional, and spiritual, Mr. Hamad's metabolic syndrome can be cured.